Are the pills in your medicine cabinet quietly damaging your brain? Millions of people, especially over 50, are taking medications every single day that have been scientifically linked to memory loss, confusion, and even dementia. And the scariest part, many of these drugs are perfectly legal, widely prescribed, and sold over the counter. In this video, we're breaking down 5 common medications that could be putting your brain at serious risk. If you're taking even one of them, you need to know what they're doing and what you can do instead. This isn't fear-mongering. It's real science your doctor may not have explained. Let's get straight into it. The first group of medications on our list is something you may have never heard of by name, but you've almost certainly taken them: anticholinergics. These are drugs that block acetylcholine, a key neurotransmitter involved in memory and learning. Now, here's the terrifying part. Studies have found that long-term use of anticholinergic medications is strongly associated with an increased risk of dementia. And I'm not talking about small risks. One major study published in JAMA Internal Medicine tracked over 3,400 adults aged 65 and older for more than 7 years. They found that those who used strong anticholinergics daily for 3 years or more had a 54% higher risk of dementia compared to those who didn't. 54%. That's not a minor increase. That's a red flag waving in your face. So what drugs are we talking about here? Diphenhydramine, found in Benadryl, nighttime cold medicine, and sleep aids like Zizquil. Oxybutynin, often prescribed for overactive bladder. Amitriptyline, a tricyclic antidepressant that's still commonly used for pain and sleep. These drugs may be doing exactly what they're supposed to in the short term, helping you sleep, calming an overactive bladder, easing discomfort, but the long-term cost might be your brain. The issue is, many of these are sold over the counter, so millions of people are taking them daily without even realizing they carry serious cognitive risks. And here's where it gets worse. The damage might not be reversible. Researchers found that even if the medication was stopped, the increased risk of dementia remained, suggesting that the brain changes are potentially permanent. If you're currently using any of these drugs, don't panic. Don't go cold turkey, but bring it up with your doctor and explore alternatives, because better options do exist. Coming in at number 2, benzodiazepines. If you've ever been prescribed something to calm your nerves, help with sleep, or manage anxiety or panic attacks, there's a good chance you've encountered these. We're talking about drugs like alprazolam, Xanax, lorazepam, Ativan, diazepam, Valium, clonazepam, Klonopin. On the surface, they seem like a miracle. They soothe anxiety, help you sleep, and quiet the mind. But beneath that calm is a growing pile of research showing that long-term benzodiazepine use may be slowly chipping away at your brain. Multiple studies have found that people who regularly take benzodiazepines have significantly higher rates of cognitive decline, especially older adults. One study published in the BMJ British Medical Journal found that taking benzodiazepines for more than 3 months was associated with a 51% increased risk of developing Alzheimer's disease. These drugs act as central nervous system depressants. They slow down brain activity, which is what makes them effective in the short term. But over time, especially with frequent use, that suppression seems to disrupt the brain's natural balance and ability to regenerate new neural pathways. And then there's the dependence. Benzos are highly addictive, and withdrawal from them can be not only unpleasant, but dangerous. That makes it even harder for people to stop once they've started. So why are they still prescribed so often? Because they work, and sometimes they're necessary. But the long-term consequences, especially on memory, cognition, and overall mental clarity, can be devastating. If you or a loved one is using benzodiazepines regularly, talk to your doctor about a tapering strategy, and look into non-drug treatments like cognitive behavioral therapy, meditation, or sleep hygiene routines. You have options. Let's talk about heartburn, acid reflux, and indigestion. Millions of people experience it, and the go-to solution? Proton pump inhibitors, or PPs. You probably know the names: omeprazole, Prilosec, esomeprazole, Nexium, lansoprazole, Prevacid. They're everywhere. You can buy them over the counter. You can take them every morning, and they work. They reduce stomach acid and bring quick relief. But here's what most people don't realize. Long-term PPI use has been linked to an increased risk of dementia. A study published in JAMA Neurology in 2016 analyzed over 73,000 older adults and found that regular PPI users had a 44% higher risk of developing dementia compared to non-users. That's nearly a 1 in 2 chance just for taking a pill most people think is harmless. So what's going on? Researchers believe that PPIs may interfere with the absorption of key nutrients, particularly vitamin B12 and magnesium, both of which are essential for proper brain function. Long-term PPI use can also lead to inflammation and changes in gut bacteria, which may indirectly impact cognitive health through the gut-brain axis. The problem is, PPIs are often used indefinitely when they were only intended for short-term treatment, 8 to 12 weeks at most. But people get comfortable, doctors refill the prescription, and years go by. So what can you do instead? Talk to your doctor about weaning off PP as if you've been taking them long-term. Try lifestyle changes like adjusting your diet, eating smaller meals, avoiding late-night snacks, and elevating your bed. Use H2 blockers like famotidine, Pepcid, as a short-term alternative under supervision. Next up are tricyclic antidepressants, or TCAs. These are older generation antidepressants, often prescribed for chronic pain, depression, sleep issues, and even migraines. Common ones include amitriptyline, nortriptyline, imipramine. Now here's the issue. These medications also have strong anticholinergic effects, which we talked about earlier. That means they interfere with acetylcholine, the neurotransmitter that helps you think, learn, and form memories. Studies have consistently shown that long-term use of TCAs is associated with a higher risk of dementia, especially in older adults. In fact, many of these medications show up on what's called the Beers criteria, a list of drugs considered potentially inappropriate for older adults due to risks like falls, confusion, and cognitive decline. So why are they still being prescribed? Because they can work well for nerve pain, fibromyalgia, and sleep when other treatments fail, and sometimes they're used in low doses, but even at lower doses, the cognitive risks may still be present, especially if taken over a long period of time. Here's where it gets tricky. A lot of people don't even know they're on a TCA. It's not always prescribed for depression. It might be for back pain, migraines, or poor sleep, but the effect on your brain is the same. If you're taking a TCA, talk to your doctor about switching to newer antidepressants, like SSRIs or SNRIs that don't carry the same dementia risk. If it's for sleep or pain, explore non-drug therapies or lower impact medications that don't interfere with brain chemicals. It's all about being informed. You don't have to stop cold turkey, but knowing the risks helps you make smarter decisions moving forward. The final group of medications on our list, antipsychotics. Now, before you scroll past this one thinking, that doesn't apply to me, you should know that these drugs are often prescribed off-label, especially to older adults with dementia symptoms, agitation, or sleep issues. Common antipsychotics include risperidone, Risperdal, olanzapine, Zyprexa, quetiapine, Seroquel. These medications are powerful, designed to treat conditions like schizophrenia and bipolar disorder. But in recent years, doctors have been prescribing them much more casually to treat behavioral symptoms in seniors, especially those in nursing homes or with Alzheimer's. Here's the terrifying truth. Not only do these medications not help in the long term, they've been linked to increased mortality, faster cognitive decline, and, yes, a higher risk of dementia. In 2005, the FDA even issued a black box warning stating that elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. So why are they still being used? Because they calm people down, they reduce agitation, they help manage difficult behaviors, but at what cost? These medications can dull a person's personality, cloud their thinking, increase the risk of falls, and accelerate cognitive decline. In some cases, they've even been shown to shrink certain areas of the brain when used long term. If you or someone you love is currently taking an antipsychotic and they're over 60, it's time to have a serious conversation with their healthcare provider. There may be safer, more humane ways to manage symptoms, like behavioral therapy, environmental adjustments, or low-risk medications with fewer side effects. Knowledge is power. Just because something is commonly prescribed doesn't mean it's safe for everyone, especially the aging brain. Let's go over the 5 medication categories one more time, because this list could literally save a life. Anticholinergics, often hiding in sleep aids, bladder meds, and allergy pills. Benzodiazepines, used for anxiety and sleep like Xanax or Ativan. Proton pump inhibitors, PPIs, acid blockers like Prilosec and Nexium, tricyclic antidepressants, TCAs, older antidepressants still widely prescribed. Antipsychotics, often used in seniors with behavioral symptoms. Here's the reality, these medications were never designed to be used long-term by older adults, yet millions are prescribed these drugs year after year, often without being warned about the cognitive risks. We're not saying these medications are evil, in some cases they're necessary, but too often they're handed out like candy, without exploring safer options, without reviewing the latest research, and without checking in on the long-term impact on your brain. And it's not just about dementia 10 years from now, the effects can show up today. Forgetting words mid-sentence, struggling to remember appointments, losing your train of thought, feeling more foggy, tired, or confused than usual. If you've noticed any of that or seen it in a loved one, it could be more than just getting older. So what should you do? First, make a list of all your medications, prescription, over-the-counter, and even supplements. Next, look up whether any of them fall into the 5 categories we discussed. Then, talk to your doctor or pharmacist. Ask directly, is this safe for my brain health long term? Finally, don't be afraid to advocate for yourself. There are modern alternatives, lifestyle changes, and holistic strategies that may work just as well, without putting your mind at risk. And if you're a caregiver for someone over 60, this information is even more critical. Many seniors are being prescribed these meds without fully understanding what they're taking. A single conversation could change their future. Here's the good news. The brain is resilient. With the right care, nutrition, sleep, and reduced exposure to harmful substances, it can repair, rewire, and renew itself. But it starts with awareness and action. So if this video opened your eyes, do one thing today. Share it. Send it to a friend, a parent, or someone you know on medication. They deserve to know the truth. And if you haven't already, subscribe to Health 365. We're here to help you stay sharp, strong, and independent with science-backed health insights every week. Your mind matters. Don't wait until it's too late to protect it.